Okay, I think we are now live. Hello, everybody. My name is Dr. Jo White, and I'm a clinical psychologist and advanced certified schema therapist. And Tena.
And I'm Tena Davies. I'm also a clinical psychologist and an advanced certified schema therapist. And we're here to talk to you about empathic confrontation, to give you some ideas on how to do it, why to do it, and to do a demonstration for you.
Okay, so empathic confrontation. Empathic confrontation is an integral part of the schema therapist stance. So it's part of the limited reparenting, where we're trying our best to meet the needs of our clients when they were the childhood needs that weren't met when they were children. And so we're trying to get a balance of both empathy, but also realistic challenge, as that's what we would expect from good parenting. And so the therapist empathizes with the beliefs and the behaviors, but also confronts their accuracy and their usefulness for meeting the person's needs. And so in empathic confrontation, we're trying to validate the schemas and the coping modes, but we're also, we're saying they're a really understandable conclusion from the experiences that the person had when they were little, but they have negative consequences. And so we're trying to distinguish with our clients between the realities of the past, but also the realities of the present. And therefore, change is what's needed for that person to move forwards. And as therapists, we can provide our clients with guidance about what might be helpful, what the changes they could make might be helpful, but also to create a space with our clients to discuss different options and instilling hope that actually change is possible. And so we're trying to find the optimum balance between the confrontation or the reality testing and the empathy. And so that will, if we get the balance right, then that really helps a client to progress. And so we aim for our clients to feel really, truly understood, as that encourages them to open up to the challenge, to the confrontation that we're offering, so that we're really an ally to them. And if we go too hard on the confrontation, then that tends to activate defensiveness. But if we're too soft, then our clients just won't hear us. So we're trying to get that balance right of the empathy, but also with the appropriate level of challenge. And so thinking about what different parts or modes you might use empathic confrontation with. So, of course, with our coping modes, so if you've got a detached protector, for example, that might be blocking imagery work, then we might want to use empathic confrontation there. If your client has a really strong compliant surrender mode, that means that they end up in situations where they get harmed. If you have a client with a self-aggrandizer mode and perhaps they're showing off as a way of trying to make friends, those would all be appropriate times to be using empathic confrontation. We can also use empathic confrontation with critic modes. So if you can identify a function of the critic mode, then you can use empathic confrontation. It tends to be less useful with a punitive critic because often there's no value, there's nothing to empathize with the punitive critic. But if you can find a function, then you can use empathic confrontation. Another mode appropriate to use empathic confrontation with is the angry child mode. So in these circumstances, I'd want to be really empathizing with the root of the anger, really validating the client's reasons for feeling angry, but confronting the way in which they express their anger. And then again, the impulsive child mode. So the focus tends to be here on the client. The impulsive child kind of gets the client's immediate pleasures met, but that blocks any healthy goals that they might be trying to reach. So really appropriate to use empathic confrontation in those circumstances too.
Yes, that's
okay,
right.
Tena.
And in terms of when you might use this, well, you really want to use it when it gets in the way of the therapeutic relationship, their therapeutic goals, or the relationships they might have with other people. And also where the coping mode, for example, might block the capacity of the healthy adult mode to be there for the vulnerable child mode. And then, of course, if you have identified that a schema or a mode is getting in the way of their therapeutic progress. Now, I know that a lot of supervisees can find it really anxiety-provoking to do empathic confrontation, and they might delay, for example, bringing this up in therapy, but I really encourage everyone to use it judiciously, but and use it freely, use it when needed, simply because it's an essential part of schema therapy. Our clients need challenge as much as they need empathy in order to shift dysfunctional patterns. So it isn't being mean, it isn't being pulling them up or calling them on things. What it really is it's about trying to change these dysfunctional patterns. And you do want to try to have some goodwill in the relationship when you do empathic confrontation. However, if the coping mode is getting in the way of the therapeutic relationship, is getting in the way of you being able to do the work with them and to connect with them, then I think it's important to do empathic confrontation earlier. And often we're doing empathic confrontation earlier in the piece with the overcompensating modes, such as the self-aggrandizer. In terms of just how to even do it, we're going to do a demonstration in a second, but generally it's done via chair work and imagery. And some things to remember when doing it are, look, ideally you do want to catch it in the moment. So something like, oh, I think that side has come out. I think that side that says I'm fine, that kind of blocks our work, has come out. Have you noticed that? So you want to catch it as it arises in the room, and they can feel it. But sometimes what happens, and probably this happens more with the overcompensating modes, is that we're a bit floored by these overcompensating modes. If someone's being very demanding or self-aggrandizing, you can sort of be sitting on your chair with your sort of jaw to the floor. It can be really difficult to do in the moment, but that's okay. That happens. It happens to all of us. And what I suggest doing in that circumstance is simply bringing it up as a reflection the following session with the client, saying something like, look, I was thinking about our last session. Remember when you said X? That really stayed with me. Do you recall when that happened? Can we talk about that a bit more? And then you can just pick up where you left off. And in some ways it's good because it shows them that you're really thinking about them, that you've been reflecting, and it encourages them to do the same. So that's kind of something to keep in mind. And as well, and this is something that a mistake you'll only make once if you forget, is you want to make sure that you confront the client's mode or their part, or, however you want to call it, the side, but you don't want to confront the actual client. Remember, we want to empathize with the client, but confront the dysfunctional part with a schema. Because if you don't want to kind of create bad blood by saying like, oh, well, you're not going to profit from therapy if you keep saying it's fine. Like, you don't want to turn this into something adversarial. You want to protect your relationship with them, with the true part of them, and then sort of split off this mode or this part that you then have the confrontation with, empathically, of course. And always link their therapeutic goals and the reason they want to change to the empathic confrontation, because this creates motivation for change and gives it a bit of rhyme and reason. Some general sort of steps in terms of doing the empathic confrontation are, firstly, reinforcing that connection with the client. So something like, Mark, I'm on your side. We're a team here. And at the same time, I notice that there's this part, right? So there I've reinforced the connection with the client and also named the part. So you can name it, whatever the detached part, the fine part, the golden boy part, if it's an over self-aggrandizer mode, for example. And then we want to point out that the part doesn't meet the client's needs, because that's ultimately why we're doing empathic confrontation. And then, and this is really important, we want to offer alternatives. We want to offer a correction. We want to offer hope and a way out, a different way that they can meet their needs, that is more pro-social perhaps, and is just going to be better for them and for everybody else too. You can find more of these tips on page 278 in the Schema Therapy Clinician's Guide, which has some steps on this and just some great reading as well. And now Joe is going to, we're going to do a demonstration for you where Joe is going to play the therapist and I'm going to be a client, and Joe will be doing some imagery to show you how it's done. Okay.
So I've just swapped us to gallery view. Okay, so I'm going to use imagery to demonstrate empathic confrontation with a demanding critic. And Tena's going to be my client, Jane. So, hi, Jane. How are you doing this week?
Yeah. God, you know how I told you I had that big presentation and I was, you know how I get myself in a knot about that PowerPoint. Oh God, I did it and I made a mistake and I was in front of the CEO. I was just so cross with myself.
Oh, it sounds like it was really, really frustrating. I wonder if you can take me to the most difficult point, Jane, of that experience. What was going on?
Yeah, I was trying to click through the slides and I kept clicking this remote thing and it just wasn't working and I was trying so hard. Yeah.
Is it okay if we do some work with this?
Yeah, absolutely.
Yeah. Can you close your eyes and just picture that moment for me?
Yeah.
Yeah, and the remote wasn't working.
No.
And how are you feeling?
Like a total failure. I feel
Okay.
stupid.
So stupid, like a total failure. What sort of feelings are you having?
Just so ashamed.
Okay. So feeling really ashamed. And is there anything going on in your body?
Oh, I just have this hot burning in my chest.
Okay. So I just want you to really focus in on that sensation in your body, the hot burning in your chest, and that sense of feeling stupid, and feeling so ashamed, and just see if you can amplify those feelings, if you can make them bigger. Yeah, and I just want you to let the image of that current situation fade and just allow yourself to float back on those feelings to a time when you were little, when you felt a similar way.
Yeah. I'm in Mrs. Smith's class and she's called me up to the front and we're supposed to know the spelling words, but I don't know all of them. Some of them are just like they're hard.
So you're at school in a class and you don't know all the spellings. Yeah. How old are you?
Oh, I don't know, grade 2 or 3, that's 8 maybe.
8 years old. Okay.
Yeah.
And how are you feeling?
I just feel so ashamed, so stupid. I just like I'm failing. Everyone's gonna know.
Okay, so really it sounds like it's a really stressful situation. You're worrying about getting things wrong.
Yeah.
Lots and lots of worries. And what do you think the teacher's going to think?
Well, she's really strict, Mrs. Smith. She's really mean. She's like, oh, she's told me before, you should know this. You should, it's the end of grade 3 now. You should know this.
Okay. Would it be okay if I come into the image with you?
Yeah.
Yeah. Where do you want to imagine me being?
Well, maybe next to me.
Okay. Jane, this situation, this is too much. It's too much stress for you. These are spellings and actually they're not important. How you're feeling and that you're okay and that you're happy, that's so much more important than your spellings. And so I wonder if, would it be okay if I have a chat with Mrs. Smith? Yeah, because I don't think that she should be talking to you like this.
No, she's so mean.
It's causing you so much worry. Yeah, okay. So I'm going to have a chat to Mrs. Smith now. Mrs. Smith, can I just pause you here? We need to pause here and have a chat. I understand that you really want the best for Jane and that you want to help her with her schooling and to make sure that she does the best that she can. But this is too much. You're causing her so much worry. The way that you're talking to her, how strict you are, and that cross voice that you're using, it's too much stress for little Jane. She, when you look at her in that way and you use that really loud voice, that really fills little Jane's body with so much worry and stress. And she feels like she can't make any mistakes. And, that's just not realistic. We all make mistakes and it's absolutely okay to make mistakes. Jane really needs encouragement and guidance from you. She needs to know that it's okay if she doesn't get all of her spellings right. It's good to work hard, but it's also really good to play and have fun and to relax. And she doesn't know that that's okay at the moment. She thinks she has to work hard and get things perfectly all of the time. And when she's bigger, she's going to really, really get worried about making any mistakes. And I don't want that for her. So can we have a think together, Mrs. Smith? Can we have a think together about how you can support Jane better? Because she doesn't need this strict way of managing her. How is that feeling, little Jane?
Oh, it's feeling a lot better. Yeah.
Yeah.
I didn't know it was normal to want to want to play. I thought I
Yeah.
just had to always be doing these spelling things.
You know what? I think you playing and having fun is far more important than your spellings. Yeah, it's okay to not be getting your spellings perfectly. Yeah, you've got loads of time to learn and you don't need to be stressing about this so much. Yeah. Is there anything else that you need? No? Okay. So I just want you to take some deep breaths then and come back into the present.
Well, it was lovely. I really like how you confronted Mrs. Smith there and really had my back and let her know the impact it was having on me. And then put in, the alternative, or started prompting what the alternative could be.
Yeah. And I think using empathic confrontation in imagery is really important, particularly, if let's say the demanding critic or guilt-inducing critic is a parent. Empathic confrontation gives you a really lovely way of helping to support your client's feelings of loyalty towards their parent at the same time as confronting the behavior or the words or that means that it's having a really negative impact on your client.
Absolutely. It gives them the language to then say to their own critic that they've internalized either from their parent or Mrs. Smith or other sources. Absolutely.
Yeah.
Okay, so now I'm going to demonstrate how to do it via chair work. And Joe is going to play Mark, who is our detached protector, who's always fine. So, hello, Mark. How are you?
Yeah, I'm fine. Yeah, I'm all right.
Has anything, I know we were talking about that situation with your boss last week. How's that gone?
Yeah, no, it's been all right. That seems to have blown over. Yeah, it's all been fine.
Yeah, and if we connect with little you, how's little you going?
I don't really.
That vulnerable part.
Yeah.
How's the vulnerability going?
Yeah, I don't know. I think it's all right. Yeah, I'm not really. Yeah, I'm not noticing anything. So I guess it's fine. Yeah, sorted, I think.
So, Paul, as you can see, I'm working really hard and he's given me nothing. So I'm going to have to change tack. So, Mark, I really like working with you and I'm so motivated to help you get the things that you really want, which is to have a meaningful relationship, to have meaningful relationships with your friends, and to feel like you're part of a group and to have that sense of belonging, But I think this fine side, the I'm fine side that we sort of have been talking about the past couple of sessions kind of has come back into the room. Have you noticed that?
Yeah, maybe.
Sort of I'm fine kind of side?
Yeah, I do feel fine.
Yeah, of course. Yes.
Oh.
I'm wondering if I would be able to speak to this side, the part that says, nah, it's fine. Is that all right?
Okay.
Right.
Yeah,
so would
yeah.
you be able to move with me? Just move to the move this side. Great. So a fine side, I really want to acknowledge the role that you have played for Mark in the past. And I absolutely know that when he was growing up, he needed you because there was no one there for him to make him feel genuinely fine, to truly hold him, to truly understand him. And you came along to numb him and tell him he was fine so that he would survive that. But now it doesn't help him anymore. It gets in the way. It gets in the way of him finding a partner. It gets in the way of him finding that sense of belonging with friends that he so desperately wants, and the reasons why he's here. And that's really difficult, and so I understand your good intentions, but I'm really going to have to ask you to step aside so that I can do the work with him.
Okay.
A bit unsure.
Mm-hmm.
We're going to have to find some other ways of meeting Mark's needs, because I want to tell you that you and me, we might be different, but we both want to protect little Mark. We want little Mark to feel safe. And I'm wondering, perhaps I can work with Mark's healthy adult to brainstorm some ideas to keep him safe.
Yeah, I think that would be good. I think I wouldn't perhaps be able to step aside until it's kind of feeling a bit more safe.
Yeah, and that's fair enough. And we're not gonna ask you to move to Siberia. We're just gonna ask you to perhaps step aside a little bit. So, Mark, do you mind just moving the other way with me? Just bring your chair. Yeah. So, healthy adult, tell me, have you got any thoughts on what we might be able to do with the fine side over there? What do you think might help bring that safety for little Mark?
I think that little Mark's really worried that you might, that he might be judged in some way for the things that he shares.
Yeah, okay.
And so, he just keeps it really quiet. And that fine side kind of, shuts it down so that then he doesn't get judged.
Yeah, okay. So does he not trust? Does he think, oh, I can't be vulnerable because I might be judged, and you can't trust other people to not judge?
Yeah. And so I wonder whether, maybe there's something about, you letting me know that you're not judging me. You're just reminding me of that when there's times when I need to share a bit more.
Yeah, okay. How about I say, look, I'm not here to judge, and how about also maybe we take it slowly? Yeah.
Sounds good.
I know I have a colleague that what he tells people to do too is to write down what your fear might be of what I might say, what the judgment might be, and you write it down and don't show me, and then see if that plays out. You get some evidence, right?
That's a good idea.
And we can take it really slowly. And if you tell me something, I promise to hold that in my heart.
Okay, thank you.
Because I want nothing more than to have you have that real sense of belonging that you absolutely deserve, that little Mark deserves so much. Yeah. So can you move back to the fine side? Fine side, how's that sitting with you?
Yeah, I think we could see how that goes. There definitely some options there that might make a difference. I'm not guaranteeing that I'm going to step aside, but we can try those ideas out.
I think that's all we can do. Yeah. And I'm going to be right here to protect little Mark, and you and me can have another little conference if we need to.
Okay.
All right. Sounds good. All right. And so that's one way you can do that via chair work.
Right. That felt really kind of validating, but also you were really clear that side of me needed to step aside, but at the same time, it felt really gentle.
Yeah.
So yeah, beautifully done.
Yeah, thank you. I liked your imagery. So that's us. If you're interested in learning more about empathic confrontation, Wendy Bahari, who is an absolute genius, has an upcoming course, and we'll pop those in the comments as well. And there's also that reading that you can do, Schema Therapy, the Schema Therapy Clinician's Guide by Farrell, Reese, and Shaw. I encourage you to read that book. It's one of the many books that one should read about Schema Therapy. So thank you so much, and we look forward to seeing you next time.
Thanks, everybody.
Thanks.